Okay, shall we get started? I see we've got quite a number of people on. So I would like to welcome everybody. My name is David Murphy. I am the CEO of One Heart Worldwide. And today we have a very special presentation about maternal and newborn health work that One Heart Worldwide is doing in Nepal. And so we have people from all around the world on this Zoom call. So literally it is morning, afternoon, evening for everyone. So again, welcome. And I would like to introduce Jagdish Upadhyaya, who is a member of our board of directors who has over 40 years experience working in global health management. And he will be the moderator for today's event. And we are very honored to have Jagdish on our board and to be the moderator and kicking us off. So without further ado, Jagdish, take it away.
Thank you, David. Let me acknowledge the presence of our ambassador to this webinar. Welcome, Mr. Ambassador. This webinar will be recorded, and I understand there are more than 187 people participating in this webinar. I hope the Nepali diaspora and other participating in this webinar will find it very useful. Before we open the presentation by Mr. Ambassador, I just wanted to share some context. Many of my friends in the international community were asking the impact on maternal and newborn health after COVID in Nepal. As we know that COVID has made a devastating effect all over the world, and the progress has slide down many years, if not decades. I was lucky to be in Nepal last year and visited a health center in a remote area and saw firsthand the work of One Heart, what they were doing it. Two things came to my mind and I noticed it and I was so happy about it. The first one was the health volunteers. These are volunteers, not paid, young women from the village, very well trained, smiling, full of passion, and they knew all about their village. You know, the women who is pregnant and what has to be done. So that is additional thing. I mean, this is something that excited me so much. I have seen many parts of the world where the volunteers work, but this one was unique. The second thing impressed me very much was the commitment from the local people. I met with the ward chief and the local politicians and others. They were very, very concerned, irrespective of political background and whatever. They were very much involved with the community work and maternal and newborn health. Also, the government of Nepal commitment was amazing. I mean, they come from their support to SDG and reproductive health and safe motherhood health was very much documented. I think the challenge is how to bring that in reality at the ground. So those 2-3 things were very impressive. And when I started looking at the facilities, you know, I was told that most maternal death happens in facilities. So what One Heart was doing was something very important because they were equipping, training people, they're providing support to health facilities and everything. So, and then I checked all the, you know, the preventive medicine that is required for maternal health, like oxytocin or magnesium sulfate or misoprostol and others. They were completely stocked out, fully stocked in the facilities, and you know, people were very trained to use it. So it was remarkable that, you know, in spite of COVID and all that, you know, that center was doing so great. And I was told there was no maternal death for last 1 year or 2 years. I don't remember exactly, but for quite some time. So that kind of model is very good in my mind. And I thought we should share what Nepal is doing at this time. when I was coming back to Kathmandu, I was told by some policymakers that Nepal is aspiring to be a middle-income country. So I thought this is also important because I remember one time development minister from Norway told me that the biggest contributing factor for the GDP growth in Norway is not the natural gas or anything, but it's the women participation in labor force. So I thought that what we are doing there, building the human capital, maternal health and newborn health, is so critical for bringing, building the women participation and building the human capital. So those things are important. I mean, the education and gender equality are equally important, but it starts with maternal health and newborn health. So I thought that is the overall context that we thought that we should organize this Zoom call and then share with our finding and what is happening in Nepal. We have amazing panelists here. But before we go there, I would like to request Mr. Ambassador for you to open the webinar. Mr. Ambassador has a very distinguished career. He assumed his in USA, I think last year in March, and before that, he was the executive director of Asia Center for Policy Studies in Kathmandu. And before that, he was executive director of Regional Center for Strategic Studies in Sri Lanka and executive director of Institute of Foreign Affairs in Kathmandu. He has many other challenging and very high-level work in Nepal. He was he was also coordinator of high-level task force on reorienting Nepal's foreign policy in a rapidly changing world from 2017 to 2018. He was the member of SAARC Advisory Committee established by the government of Nepal. He also served as advisor of the Nepal delegation to the 11th SAARC summit in January 2002. So he has a very distinct career. He has a long bio, and people have so much regards and respect for Mr. Ambassador Sridhar Khatri, who is here to open this webinar. Mr. Ambassador, floor is yours.
And thank you for a very generous summary of my background. David Murphy, CEO of One Heart Worldwide, Surya Bhatta, Executive Director, Dr. Swaraj Rajbhandari, Dr. Kirsten Meisinger, and Jarvis J, and distinguished guests from all over the world. Namaste and good morning to you in the Western Hemisphere, and good evening to you in Nepal and in South Asia. It is, I must say, a pleasure again to join you in this webinar and to meet again virtually David Murphy and Surya Ji after having met them in April of this year. It was a pleasure to know what they were doing with the World One Heart Worldwide, and they gave me a very good background on the work that they were doing. And I think since then, there has been a certain degree of attachment, again, of the embassy with the generous contribution they had made to Nepal. I think one of the significant role that One Heart World has played is not only consistently supporting Nepal in the health sector, but also acting during times of difficulties in Nepal. The contribution made again in the post-earthquake phase in 2015, and again after the COVID pandemic, was very significant. And these are things I don't think the Nepalese people will forget in a long time, because it is at these moments when friends act and those memories become lasting for those beneficiaries who needed them so much. As you all know, we have a constitution that was promulgated in 2015. And one of the, I think, outstanding features, among others, of the constitution is that it recognizes health as a fundamental right of the people. I think that says a lot about where Nepal is going in terms of democracy and emphasizing the rights of its citizens and the benefits they are expected to get from the government. In terms of the health sector, there are many acts that have been put in place, and I will not try to say that those acts are an end-in-all process. They are just the beginning of things that needs to be done, and that indicates how serious the government is in terms of implementing programs to deliver goods to the people. There is the Nepal Health Strategy, that will take effect from 2023 to 2030. It looks at different phases of monitoring and implementation of reproductive, maternal, newborn, child and adolescent health. There is also the Health Insurance Act that came into, that was brought about in 2017. And it provides a very ambitious government social health insurance program to ensure that there is universal health coverage. Some of these schemes also allow for partnership between the private sector and the government, and includes, maternity care services as well. There is also the Safe Motherhood and Reproductive Health Act of 2018 that guarantees reproductive rights of every woman and makes specific provisions for maternity care, maternity leave. Again, this is something new for Nepal and something very forward-looking also. The important thing is that the Act also gives direction to provincial and local governments to allocate funds for reproductive health services. I think these are positive directions, but if you look at it in terms of, I think the decline in maternity mortality in Nepal, we have been, moving up and down in certain direction. There was significant progress made between 1996 and 2006. And again, from 2000 onwards, somehow the progress has been kind of slow. But again, situations are being looked after, and I think it is being taken, we see more positive trends in terms of the way it is moving for maternity mortality within Nepal. But the trend is also suggests that it is very unlikely that Nepal will attain Sustainable Development Goal, SDG 3 targets on maternal and newborn mortality, unless concentrated efforts are made to accelerate a reduction in MMR and newborn mortality rates. This is something I think that needs a lot of attention in the days to come. One thing we are very assured is that with, organization like One Heart Worldwide, there will be concentrated effort made by the government working together with, bodies like yours to bring about changes and to try to meet the targets of the SDGs in the future. One of the important points I think we appreciate very much in Nepal is the support One Heart Worldwide has provided to the rural communities and families in Nepal. You have been able to reach people where the attention is needed the most. Again, it is a pleasure to be with you. I wish you success with your meeting. And if there is anything we can do from the embassy side in the future to coordinate with you in your work, we're ready and to work with you again. Thank you for inviting me. It was a pleasure to be with you.
Thank you, Mr. Ambassador. Thank you very much. we really appreciate your coming here and assuring us that your embassy and government support will be always with us. We really appreciate for it. Now, I just wanted to let you know that how we have, we will run this webinar. What we will do now is we will take the global context, what is happening in maternal and newborn health, and then move to Nepal's situation, compared with the regional countries and where we are and what are the things that we are doing it, and some of the things that we can probably replicate in other countries as well, and some of the things that we have to face ourselves, we have to correct ourselves. So that's the format that we will be using, starting with the global context. And I would invite our board chair, Dr. Kirsten Meisinger, who is a medical doctor practicing family medicine since 1999 at Cambridge Health Alliance at Boston. She's the director of system transformation and leadership at the Harvard Medical School Center for Primary Care. And one amazing thing she told me that she is the mother of 3, and they had delivered by midwife. All 3 children were delivered by midwife. I mean, she's practicing what she's teaching. So welcome, Dr. Kirsten. Floor is yours.
Thank you. It is truly an honor to be part of this panel. And as the Honorable Ambassador said, Nepal is actually emerging as a leader in the worldwide context of maternal and child mortality because of the amazing support that the country has had for organizations that are visionary, like One Heart Worldwide. Katie, if you want to go to the next slide. Happily, maternal mortality has been falling around the world. And if you look that globally, the lifetime risk of a 15-year-old girl eventually dying from a maternal cause almost halved in the past 20 years, which is wonderful news. Notably, the greatest reduction in lifetime risk has actually fallen in Central and Southern Asia. And it is due to the work of the wonderful experts we're going to hear from today that have changed the life, not just as the Honorable Ambassador and Jagdish illustrated, of one person, a 15-year-old mom, and that family. It is actually changing the life of a country. And that, I think, is the important part as we think about the global context. Go ahead. In the United States and in Europe, actually, maternal mortality is not decreasing. It's actually rising. And this has garnered a lot of information sharing from other parts of the world. And I'm excited for us to be able to learn from our partners in Nepal to be able to reverse this trend in our own countries. If you can see from the slide before, just one more, Katie, sorry, the United States is actually a leader in mortality. This is not what we want to be a leader in. You can continue. Even in states like Massachusetts, which is where this data is from, that have universal access to care, and universal access to care is absolutely crucial for health, we are seeing an increase in maternal mortality and morbidity. Can carry on. So how can we learn from the decrease in maternal mortality in Nepal while our maternal mortality in the United States increases? Now, one thing that's important to notice from these slides is that the order of magnitude is entirely different. We can go to the next slide, Katie. And it's a brief reminder of how important structural determinants of health are in this work. Clearly, how we spend our healthcare dollars matters. You can see that strategies at One Heart Worldwide uses have made a tremendous difference in a resource-poor environment. But the simple fact remains that when your environment is resource poor, when your people are impoverished at a completely different level in Nepal than you are in the United States, you're still going to see the absolute numbers be dramatically different. And what does that really mean? It means that there's an 18-year difference in life expectancy between a country that is high and versus a country that's low income. Income matters. That is why the family is the future of the country, and starting them strong from the beginning matters. Action really requires not only equitable access to healthcare, but it also means working outside of the healthcare system narrowly defined to address broader social well-being and development. And this is taken directly from the WHO. That framing is especially important for an organization like One Heart, which has always operated from that principle of capitalizing on all of the strengths in society and going to the communities and transforming the entire community to be able to improve the health of the family. And with that, I would love to turn it back to Jagdish. What can we learn from One Heart? What are you doing so well? Let's hear from them, the team themselves.
Thank you, Dr. Kirsten. It was a pleasure knowing the global situation as well as the US situation. And you correctly pointed out that maternal health is not only the issue of medical concern, it's the broader issue. And I remember, because I come from the old school, in 80s, there was Professor Mahmoud Fatala. He produced an animated film. I don't know how many people have seen this, but it was probably 1980s. And he said there was a woman of 39 years old who died after the delivery. And he looked at all the situations. She was poor, she was uneducated, and healthcare system was not equipped. So he then looked at all three factors. If she could have been more higher economy, she could have been saved. If she could have been educated, she could have been saved. And if the healthcare facilities was quick enough and equipped enough, then she could have saved. So it's a broader context. And within that broader context, I would like to invite Dr. Swaraj Rajbhandari. She has a distinguished career with so many medals that it will be difficult to read out all that she has achieved. And we are so proud to have Dr. Swaraj on this panel, because she has worked not only in Nepal, but in many other countries, so she can compare and contrast. She graduated in 1979, and then she has done degree in public health from Johns Hopkins, worked with USAID, worked in Indonesia, Malaysia, and Caribbean countries. She came back in 2002 in Nepal, and last year, I believe she was awarded Women in Medicine Nepal Award by the President of Nepal. It was last year. She has also received Lifetime Achievement Award from FIGO President. She has many awards. So I will not read out all those awards, but she had amazing experience, both in Nepal and, when she was working in Nepal, immediately after her graduation, she has traveled a lot within Nepal, in every villages, and she has a first-hand experience how women and newborn are having difficulties in facing the access to public health. One thing also, I don't know how to put it here, but she lost her first child, so she felt that it's her responsibility to serve the women and newborn in Nepal. So it's amazing story of a person who went back to Nepal, serving the women and children health, both maternal and newborn health, particularly for Nepal. I would like to invite Dr. Swaraj come and share with us where are we in terms of maternal and newborn health, and compare that with the regional countries and context. Tell us the challenges now and in future, and how we will achieve SDG target, because SDG goal that we committed to achieve, and what are the things that we have to do. Swaraj, floor is yours.
Doctor, you might still be on mute.
Okay. Namaste. Very good evening, good morning, good afternoon. And thank you, Jagdish ji, for that kind introduction. Could you please go back to the previous slide, Katie, just for a second? This is really honor and privilege to be talking about the status of maternal and neonatal health in Nepal. As all our previous speakers have already mentioned, that Nepal had made remarkable progress in improving both maternal and neonatal health. And this is due to various factors, because the policy, strategy, guidelines, standards being in place, and the programs like Safe Motherhood Policy, also like increasing in the number of the skilled healthcare providers, having the free maternal health services, incentive schemes to improve the antenatal care and the postpartum visits, also like focusing on birth preparedness package and also preparing for the complication management. I think there are multiple factors comes to the place why we reached to this stage. It is not only one factor which has contributed. So I just wanted to give a brief background and where we are now and where we want to reach. Next slide, please. Kirsten had already mentioned about the global scenario of maternal mortality ratio. So maternal mortality ratio is not only the number like 100. We have come a long way since 1996 to 2021. We have been able to decrease the number to 151 per 100,000 live births, but then this is still a daunting task to reach our SDG target of 70, like our ambassador had already mentioned, and we really have to pull up our socks and work in coordination. And with all the partners, the government is committed to reach our SDG goal. And just to give you the scenario and compare with our partners, neighboring countries, we are really I think, although we have come down in the number, I think we really have to work very hard to reach our target in 2030. And the bar graph on the right side, I wanted to share that Nepal is a federal country now, and the 7 provinces gives us the glance that the provinces have got, again, like there is disparity, Bagmati province being doing good, but if you look at the Lumbini and Karnali, the maternal mortality ratio is still high. Next, please. So what is the age group when women are dying? As you can clearly see in this slide that the younger age group, 15 to 19 and 20 to 24, I think more than 50% of death is occurring in this age group. So there are many reasons to that. And if we go and look into the next slide, that gives us a picture that why these women are dying. In Nepal, the legal age of marriage is 18, but in many provinces and all over Nepal, the child marriage and the marriage before 15 is still very prevalent. Like you see by the province, Madhes and Karnali and Sudur Paksham, the far western region, still the girls are getting married before 15, thus leading to the early marriage, early childbirth, and the adolescent mortality is being very high because they are not able to reach to the health facility as and when needed. And if you look from the other side of the bar graph, that again there is a disparity among the ethnic groups like the Dalit, Madhesi, and Muslims, because they also get married at a very low, younger age group, and the mortality again is very high. I think this is the early marriage and the child marriage is one of the reasons, and not being able to access to the health facility is another reason. Next, please. And this is the good news. I'm very happy to share this slide that the institutional delivery or health facility births has really increased, and currently it is 79%, which is a very exciting news. But there is a disparity. If you see that, I think we will definitely reach our target in 2030, the way we are going. But if you see the disparity, that the women of the highest wealth quintile, I think almost 100% are reaching to the health facility, whereas the lowest wealth quintile people are not reaching, because they are the one who have the problems and issues and they are not able to reach. And then after a few slides, I will explain what are the reasons for that. And again, going back to the province, there is quite a disparity between the provinces. Next, please. This is something I think Nepal is proud of in reduction of the population growth. As you can see that we started with 4.1 in 2001 and now it is 2.1. And just to compare that, if a girl or woman is educated, if they have a education from 10 grades and above, I think their family size still smaller, of the national average. But if the mother is, they have no education and the family size still higher. And this really shows that we really have to focus upon the education of the girl child, and that really improves the health of the family and the children and so on and so forth in the future. Again, like the total fertility rate by province, there is the Madhya province and the Karnali province is really, I think their family size is a lot higher than the national average. Next, please. This goes back in relation with the institutional delivery as well as, the disparity of the education and the ethnic groups. Here you can see that the postpartum family planning uptake is, again, poor in the Madhya province, Karnali and Sudur Pakshim, because the institutional delivery is low. And again, like because of the early marriage and all those issues, I think the postpartum family planning uptake has not been so well in these provinces. And just to highlight one more point, that those young married couple, especially among the adolescents, the family planning uptake is about 14% only, as compared to the 46% of the contraceptive prevalence rate of the national data. Next. This is again like a exciting graph to share with, because the trends in early childhood mortality deaths per 1,000 live births in the 5-year period before the survey, it's like under 5 mortality and infant mortality. I think we are on target. It has been reducing from 1996 till now. Where we are stuck is stagnant is the neonatal mortality, which is like the 21 in 2016, and we are still 21 in 2022. And unless we really put our focus on this neonatal management, especially at the district level, I think this is going to be a very, very challenging task to reach our SDG goal of 12 per 1,000 live births. And the provinces are again doing like there is a disparity from the far western region, Karnali and Madhya province. Next, please. Many of us, we have this notion that, well, in Asia, the breastfeeding practice is excellent. It is excellent when we take the data of the 2 years, but the most important part of the breastfeeding practice, which is the initiation of breastfeeding within an hour of birth, is only 50%. That is kind of a very sad news for us. And also exclusive breastfeeding for the first 2 days after birth is also less than 60%. Here, I think in this area, we really have to work very hard. And one of the striking factor which I can share with you is that the urbanized province, Bagmati, Gandaki, and the highly educated people, I think these people are going to the private sector. And I think these are the ones who are undergoing more cesarean section than in the private sector, than in the public sector. And their breastfeeding practice is poor in comparison to the Karnali and Sudur Pakshim. And I think in this area, the far western region is doing much, much better. Next, please. Like in the earlier slide, I had shown that there is a disparity between the lowest wealth quintile people and the wealthiest wealth quintile women. Here, like there are problems in accessing healthcare because they have to get permission from their in-laws, husband, and also they are economically dependent. The distance to the health facility is still an issue, not wanting to go alone or not letting them go alone. I think these are the various factors in spite of our free transportation, I mean, there is an allowance for the transportation, in spite of the fact that the services are free, despite the fact that there is the scheme, but still women are having problems in accessing healthcare. I think these are the group of the people now the program has to focus upon. Next, please. As we know that the anemia is the indirect killer, especially women of reproductive age group, and as well as women during labor. In the maternal mortality, I just wanted to highlight one point, that before COVID, our cause of maternal mortality was eclampsia, but after COVID, during COVID and after COVID, the number again has, the postpartum hemorrhage has taken the toll. So again, like anemia is kind of the indirect cause, and if the woman is anemic and if she bleeds, I think that is the catastrophe. All of us, we know, as an obstetrician, as a family practitioner, I think all of us, we have faced these challenges. I think again, this is the area we have done well in terms of the anemia among the women, but I think we really have to again emphasize on the under 5 children. I think we really have to improve on that. Next. This is the slide to share that, we have basic emergency obstetric care in many parts of Nepal. Like Jagdish has mentioned that he has visited many health facilities. So out of these 7 signal functions, since postpartum hemorrhage is the major killer, you can see here that during the time when the survey was done, I think 3 months before that, at least almost 90% of the healthcare provider were saying that they use the oxytocin to prevent postpartum hemorrhage, and they were doing to active management of 3rd stage of labor, which is exciting news. But at the same time, the other signal functions, I think we really have to work hard to improve on the parenteral anticonvulsants and the manual removal of placenta and so on and so forth. But this is the good news to share, that oxytocins are available everywhere and they are practicing this. Thank you. Next. Like I had mentioned earlier, that I think our institutional delivery has increased and our antenatal visits have increased. Our postpartum visits by the staff have been excellent, but I think the quality is a question. I think all of us, we are struggling with now. And I want you to focus upon the last bar with the trained staff. I think by the time this survey was done in 2015, I think the trained staff were available 35%, but now it is decreased to 29%. And this is worrying scenario, because why they are not available? There could be various reasons, maternity leave or in training or transferred and so on and so forth. But not having a trained staff in the health facility is directly correlated to the unavailability of the vacuum aspiration MVA kit and unavailability of the vacuum aspirator, because if we do not have trained staff, and there will be no use of having the equipments, those life-saving equipments. I think, again, like this human resource is one area the government is also worried, and the partners are also working very hard. And now the local government are hiring, the short-term in contract. So I think they are working in various ways. Thank you. Next slide, please. And this is, I think I love this slide to share, because again, this is when we compare with the neighboring countries, then we know where we stand. No matter how much we say that, oh, we are having this problem, these issues and that issue, but this slide definitely shows that we are on target in infant mortality rate and under 5 mortality rate. If you compare with Pakistan, India, Bangladesh, I think Nepal is doing very well here. And institutional delivery also, we are going ahead and will be on the target. And this slide shows that no matter what the context is, we have worked very hard to reach where we are now, and we really have to expedite, and we have to put our resources and our energy, everything together to reach our SDG goal. Next slide, please. To summarize what I have mentioned here, that we have come a long way. And like Kirsten had already mentioned, that the maternal health is not only, or neonatal health is not only the medical issue, it is also like related to the economic development. If a woman, if the girl is educated, she can take after, look after the family, she can be economically sound, she can support the family, and then, you know, she can improve the health of the newborn as well as the child, and in the future adults. And we have seen that neonatal mortality is stagnant, and it needs special effort to reduce. Inequality across all the provinces is very high. It is again like because of various factors, and education levels and the disparity in ethnic groups. We really have to be very, very cautious about this while implementing the program. And we really have to focus upon the adolescent health, and, you know, try to work on again, like to reduce the child marriage, to reduce the early marriage, and even if they get married, at least delay the child, to plan the family properly. And breastfeeding practice, again, this year during the breastfeeding week, I think this was the highlight, that we have to work very hard to improve our early initiation and the exclusive breastfeeding. Anemia, we have come a long way, but still, I think we really have to focus on the nutrition and the iron supplementation, which is already started from the school program. And I've already mentioned about the quality, that quality is an issue. We really have to improve upon the quality, not the numbers, and how to reduce the multiple problems of the women. I think we all have to work hard to reach, you know, so that they can reach to the health facility, and we can reduce the maternal mortality and the neonatal mortality in a timely manner, and we can reach our SDG goal as planned. Thank you very much. I'll stop here, and I think the programmers, now we can focus upon where are the challenges and where are the issues and how to go forward. Thank you.
Thank you, Dr. Swaraj. At this point of time, I just wanted to inform that Mr. Ambassador has to leave. He has another meeting. But again, thank you so much, Mr. Ambassador, for being here and and opening this webinar. I would also urge the participants, if you have any question to any specific panelist or to everyone, please write your questions. And we will try to answer as we get it. And if we have given the time factors, because we are running a little late now. My input on Dr. Swaraj's presentation is excellent presentation. You said that maternal and newborn health is not only medical issue, it's a broader issue. I would, just urge the issue about contraceptive prevalence rate, which is very stagnant, as I understand, for so many years. Unmet need of family planning is very high. So we have to provide choice and give the choice to women, and the type of contraceptives that are available in some other provinces are very, very limited, as I have seen it. Another issue I would again highlight is gender equality issue, and you also highlighted that, Dr. Swaraj, on this. I think we have to work on this, and education. Those are the three things that I'm also personally dedicated to serve in Nepal, and will continue doing it. At this time, I would like to invite our Executive Director, Dr. Surya Bhatta. He is amazing young public health leader in Nepal. I'm so impressed by him. He's a graduate from Dartmouth College and Harvard. He has a decade of experiences in serving public health in Nepal. He's our executive director, as I said, and he's involved in various government, international organizations, NGO, and policy committees and everything. The one particularly thing I was told by Ministry of Health when I met them, there's some senior people, they talked about him, his great work during the COVID time. They all, appreciated what he and One Heart did it through him, was very much appreciated by the government of Nepal, and particularly Surya's leadership on this issue. We want more Suryas and more Swaraj in Nepal to make a difference So Surya, floor is yours.
Thank you, Jagdish, sir. I'm so honored. I know our ambassador has left, but I know still we have colleagues from embassy. So thank you, Omkanda sir, for arranging all this. I really give you the credit for all this arrangement and the secretary there. So thank you for walking through all the situation, and I think we have a better idea where we are now with the maternal newborn health, from global context to Nepal context, and the regional disparities among different provinces, ethnic group, age wise. So many different determinants that is really contributing to the maternal newborn health outcomes. So I would be talking about what One Heart Worldwide is doing in this context. So what is our intervention and how we are dealing with this, so we can contribute to the the SDG target. So One Heart Worldwide, always works with the government. I will just briefly take what is our model, network of safety. We work with government. We never create the parallel system. It's all about strengthening what is there. We support the health facilities, upgrade their institutional capacity, improve the service readiness and quality. We work with the health service providers, skilled birth attendants, nurses, providing the maternal newborn health services. So who can provide the quality health services at the point of care. And then we work with the female community health volunteers, healthcare providers, all different cadres of healthcare delivery system of Nepal. And we work with the communities because our work is by the community to the community for the community. We receive the significant support from the community in our program, not only their solidarity but also the cost. And we work with families, who is really important part of decision making process. And at the end of this circle, we have a mom and babies. That's what we are working for. Next. So Dr. Swaraj has mentioned quite a lot about the regional disparities, and you can see very clearly where we are right now. One Heart Worldwide started with, started the program from Eastern Nepal, moving to the Middle Hill, and then now we are strategically moving to the Karnali and Madhesh, where the most of the health outcomes are comparatively poorer than national average. So our focus right now, we have already completed 11 districts. You can see in the green. We are about to transition, and I will explain more about the completion and then transition and active implementation later. But we have already, reached multiple districts in Nepal, and many of these districts has shown very significant results where we have already graduated. Next. So our model is quite adaptive and nimble. You can see, the first year, One Heart Worldwide is very much linked with the local priorities. Our work is designed here with the local municipality government, guided by the national health strategy and the local law and policies. So first year, we set up our system there to the need assessment, baseline facility surveys, all those, different qualitative, quantitative population-based surveys. And then from the second year, based on our findings, we start implementing our program and do the active program implementation and the major investment. Second, third, fourth year is a year where we make a lot of investment in partnership with the various tier of government, particularly local government and provincial government. Largely, we do the facility upgrade, training healthcare providers. I will talk more about what those activities later. And then we have an exit plan for the fifth and sixth year, where we transfer the knowledge skill to the local healthcare providers and local municipality government, and then share our findings, learnings, and then move out there. So there is some level of retention and sharing before we leave, and the things doesn't fall apart. And even after we leave the district, we keep track of the key performance indicator, so we are aware about what is happening in our program districts. Next. So we do a bunch of activities, but I will highlight the major activities that we are currently doing. We help to renovate or construct the new birthing center to increase the access and also the service quality in those rural areas. We provide the life-saving medicals support, equipments and supplies that is required for the service quality service delivery. we do the health facility and the support to the healthcare providers, so they are able to provide the quality health services. And then we improve the service readiness through different minimum services standard and other government tools and techniques. We are also doing a lot of research innovation. One of some of them are recently we have implemented simulation based mentorship program, and then other digital health technology program that is ongoing. We do the capacity building of local government since 2015. Then Nepal is exercising the federal um, federal government structure. So we have learned that the local government required a lot of technical assistance and support to plan the budget and their how do the evidence-based planning and best practices. So we have been supporting local government on this. And one of the important aspect of our program is cost sharing with local government. So many of this work we are doing in partnership with local government. So they there is a sense of ownership when we leave the place. So these are the highlights of the activities, but we do a bunch of different activities in order to improve the service quality, service coverage, and improve the demand of the services. Next. So far we have trained about 21,000 female community health volunteers, renovated or constructed 160 health birthing centers, equipped around 500 birthing center, and trained around 700 skilled birth attendants in various training. We have also trained around 171 SBEs on ultrasound training, rural ultrasound training. We have trained over 18,000 stakeholders to improve the service, the governance and the service of the health facilities. And we have done the quality intervention in around 500 health facilities to improve the service readiness and service quality of health facilities. So one of the thing, Jagdish sir also mentioned, and we also, our ambassador also highlighted, I think that is the connection we have made with the embassy when we are trying to get these supplies to Nepal from, from all the way to US. So one of the highlight of, One Heart has been always adaptive and responsive to the any kind of challenges that goes to the country. So we have been able to make, significant support and contribution to the Nepal's health system during the time of COVID. Of course, this is the logistic supplies we have provided, but on top of that, we have led different, procurement, technical assistance, being part of the different policy working group, leading the Association of International Organizations procurement, and also various, support in the Ministry of Health, Ministry of Women and Children, Social Welfare Council. So we have been one of the key responder in earthquake and the COVID. So this is just a highlight of, what we have done. We have reached over 2,000 health facility in that time, provided various, just support that was required at the time of COVID. Next. So our goal to reach all the places where the need is highest. That's what we aim to do by 2030. And basically help government to reach the SDG. That's really what we are aiming for. We will be reaching out 165 annual pregnancy per year in 21 districts, covering the 6.6 million population. We have already, since the beginning, we have already hit the 1 million lives of mothers and pregnant mothers, mothers and the newborns. And the next step is to really, hit all those areas I mentioned earlier, hit those areas where we have the greatest need and support the Ministry of Health to achieve the Sustainable Development Goal for maternal newborn health outcomes. So this is number that we have reached so far, and this is a projection that we will be hitting in by 2030. So we have, this is also the year that we have hit 1 million lives, which is very exciting, starting from very small, like a few villages to, when we started in 2010 to right now. So this is a very exciting moment that we are hitting the, almost 1 million lives as of now. Yeah, thank you so much for taking time to attend us, and especially all the speaker, Dr. Swaraj, my friend and board chair, Dr. Kirsten, David, Jagdish sir, for taking time to mention about it, and a special thank you to the our Honorable Ambassador, Dr. Khatri. It was such a pleasure meeting you in DC a few months back, and thank you for joining us and the entire Nepal Embassy in the US.
Thank you,
Over to
Surya,
you,
for wonderful progress that you have made in Nepal and under your leadership. We are so impressed about it. Now, at this time, I think we got some question and panelists are writing answer to specific question, send it to them. I'm so happy to read all the question and answer right now. I don't see any other question and the time is coming close to now. What I would like to say that, this is not particularly any fundraising event or anything, but, the Nepali diaspora or any other person who is part of this discussion, and if you would like to be part of, the support to Nepal in this area, please visit our website, which is here, or send them email, David Murphy, david@oneheartworldwide.org or surya@oneheartworldwide.org. It's on the thing, on the web. And then, you can provide support, ask question. This kind of webinar, we will continue doing it for sharing some critical information about Nepal in this area. And then if you have some special queries about it. This webinar is, participated by a large group of people from around the world. And if you would like to support or be part of it anyway with your expertise or anything, as I said it, connect with our website and then let us know how you would like to connect with us. With this note, and it's about time, exact 1 hour, we promised to be here. I would like to thank you, all of you, the panelists, the participants, Mr. Ambassador, David, and Nepal team, and everyone who is participating. Thank you so much. Thank you for being here, and I hope you enjoyed this panel discussion. Thank you.